Thank you very much, Mr. Donfrid. Can you hear me?
Yes, yes.
Okay. Good morning, everybody. I'm really honored to be invited to address today to the students from all over the world. And I'm also honored to be in such with such highly esteemed panelists as my ex-colleague, Dr. Miljan Rančić and His Excellency Ambassador. Especially in the time of a pandemic, there is really the need of promoting and spreading health culture and understanding the concepts of global health through cultural health diplomacy. And as I'm not employed anymore within WHO, I'm retired. I'm the retired head of the World Health Organization European Center for Environment and Health, which is located in Bonn, Germany. And I'm saying this because I'm going to talk today about some wider, more strategic aspects of current pandemic and the possible positive role of health diplomacy in spreading such comprehensive view on the topic in order, in fact, to deal with this current pandemic and to the future events. So in this context, I would like to mention some aspects of understanding the origins of the virus that are linked to environmental impacts of health, in a wide context of global health. Spreading such scientifically based concepts of understanding is to understand that humankind is biologically connected to other living beings. And in fact, all the living beings are interconnected by laws of nature. In addition to that, of course, human being is an intellectual being. And though it's the only species that is able to destroy natural living conditions of other species, but also to be constructive and to make something positive. And the events during past 20 years, with several serious reminders and are testifying that not much has been done in spreading enough warnings through health cultural diplomacy. I can be a bit more critical towards WHO after retiring. And Miljan also mentioned some of the challenges, and many of them are, in fact, we can be able to overcome it, but not only WHO as itself. Here I see the role of health cultural diplomacy to support WHO, because all WHO recommendations and positions and not even political declarations, but guidelines, for example, which are technical documents, they are based on scientific knowledge. And in this pandemic, we see that a lot of people is doubting scientific knowledge, and they even lack a basic knowledge. So just let me mention a SARS outbreak in 2003, meaning severe acute respiratory syndrome caused by coronavirus, which spread from the animals to the people. And then MERS, 2012, Middle East respiratory syndrome. And then now the name of the virus that is causing COVID-19 is again SARS, CoV 2. We now have another co-virus spreading to the people. And people are saying what? Oh, for the first time we hear from coronavirus. No, it's a well-known now for 20 years zoonotic disease. And then the other zoonotic diseases. Zoonotic diseases meaning the diseases which a primary host to this virus, this microbe, which is the cause of infection, are animals. But then they're spreading to the humans. And I'll say a few words why, and why we need this strategic approach. So we had also influenza viruses, especially type A, Milan mentioned the swine flu. We also had the birds flu. So it's well known and appearing more often in the past 2 decades, these new zoonotic diseases. Why? Are we asking ourselves why? Well, as I said, humankind is also the only species that can destroy natural habitat for the animals and the natural habitat for human beings as well. And then when they are destroyed, these natural habitats, you have all heard about endangered species. Species are tend, and they are, some of them extinguished, they don't exist. So the viruses, the microorganisms that were in their organisms, they try and they tend to survive. So they are trying to find a new host. And in these cases, human hosts in order to survive. So how can we influence and get in contact with these viruses from the animals? We take the actions causing climate change. And a lot of species tend to be extinguished completely, or we are intruding their habitats by urbanization, by hunting, by using them for food, by deforestation, meaning intruding into their habitats and making contacts, which makes it possible then. So World Health Organization has been warning many times during past 2 decades on the possible grave consequences of zoonotic diseases, as there are many of them. I have mentioned only these that I assume that you have at least heard of them because it was publicly available worldwide, but not in a wider context, why it's happening. It's like a temporary panic, and I'm afraid that this time would be the same. Nevertheless, this is a really grave situation. And then when it passes, we forget about the causes and forget about the measures that should be taken, and then business as usual. So this could be really an important role of cultural diplomacy to change this pattern after this really now serious reminder. Just to mention, for this SARS 2003, 30 plus countries were affected in Asia, though. So it was not like it's nothing. So now we have another facts. And I have mentioned Bonn as the seat of WHO European Center for Environment and Health, but Bonn also is the seat of UNEP Eurobats. And what is UNEP Eurobats? UNEP, some 20 plus years ago, recognized bats as the endangered species. And this is an agreement on the conservation of European bats. Unfortunately, in Asia is similar situation, but they don't recognize the need of protection of their bats. It was not recognized why it is important. And for the general public, we could say, yeah, bats, they are protecting some bats in some caves somewhere. Why is it important? Now we see why it is important, because this coronavirus is originated from the bats. What is still unknown for sure is that intermediate host between a human being and bat. Everything which is so far scientifically known is that the origin is in bats. These viruses are originally attacking bats, and that there is a high probability they didn't, let me say, jump into the humans directly, but there must be some intermediate host, and this is what is unknown. So it is important really through health culture diplomacy activities to share these facts and knowledge in a wider context in this era of Anthropocene, when the humankind interventions in the natural habitats, in the nature, are in fact endangering its own future, because it reached and overreached planetary boundaries. When I say planetary boundaries, I mean of the living beings, not of the geology of the planet Earth. And this is well known, and this can be overcome only by these global strategic approaches. We could see through these pandemics that people are not even aware now, a lot of people, that they are human beings, are subjects to the law of nature, of biology. Nevertheless, we are smart, we have brains, we have smartphones and laptops and homes, and of course we can use, and we use our brains for positive things. But there are some facts that we are also forgetting. And this pandemic challenge will not be resolved in the hospitals and not purely by medicine, dealing with consequences. That won't be possible. This would be a lost battle. The key is in the prevention, starting from the change of behavior towards nature as the basic primary prevention, to make these dramatic events of zoonotic epidemics and pandemics rare. And Milan explained the way how it can be also detected on time, but if it's too often, it cannot be then detected on time. Then, meaning prevention through vaccination, again, being aware that human beings are subject to biological laws. And World Health Organization and many countries were in the past champions of developing something which was known for the first time in the history of humankind, but being well aware of biological nature of human beings, developing so-called herd immunity. And I'll say also in Serbian, for the students, Serbian students, to know that the Serbian word is collective immunity. Why I'm saying that? Because it's well known for decades. It's nothing new, but it can be only developed through vaccination. There is no other way to develop it. I mean, to develop it and not to wait several thousands of years. This would be the natural way, because we had also these mistakes and still mistakes in the treatment of prevention and measures. So it's possible, and it is developed for the first time through the history of medicine and humankind, when massive vaccination eradicated some diseases. Yeah? And Milan mentioned what was a public health emergency of international concern, re-emergence of polio. And re-emergence of polio because of lack of vaccination. Otherwise, it was almost eradicated. This is what we have with measles as well. So we stop vaccinating. There is no way that the disease will stop spreading. And then the last part of prevention, through applying anti-epidemic measures, which is also must have as the core point the awareness, how the virus is spreading, how the biological beings, human beings, are spreading the virus, being subjects of the laws of nature. By contact, breathing, not stopping, not wearing masks, having direct contact, not having distance, not washing the hands. So I would finish here by saying that, that the need to spread these main messages, which are, of course, provided by the World Health Organization, for decades, and now again, through health culture diplomacy to reach policymakers, decision makers, general public, and also healthcare professionals, because some of them are not aware of these facts. And I'll stop here from a bit different perspective, more specific through the examples, more specific than Milan had explained. And I'm also ready to answer to your questions during the discussion. Thank you very much.